When Angelica was 16, she found out she was pregnant only when she noticed her hips were getting wider. By then, she was already 2 months along.
Ano po, 2 months ko na po nalaman, malaki na yung tiyan ko. Parang di pa po konti biglaan lang.
Angelica was in her senior year of high school, just about to graduate. Her parents encouraged her to keep studying.
Sabi po sa akin ng magulang ko, ipagpatuloy ko daw yung pag-aaral ko. Kaso po naunahan po ako ng hiya. Ako po yung may ayaw. Kasi nahiya po ako sa mga classmate.
Bakit ka nahiya?
Nabuntis po ako ng maaga.
Angelica is one of the hundreds of thousands of young girls in the Philippines who got pregnant in their teens. The Commission on Population and Development, or POPCOM, has called on President Rodrigo Duterte to call a national emergency. How bad is the situation of young mothers in the Philippines? The Philippine Statistics Authority says there are 24 babies being born to teen mothers every hour. POPCOM says that the increasing cases of pregnancy among younger children aged 10 to 14 may be linked to abuse. And the cycle goes on, as studies show that children born to teen parents are likely to be poor, be exposed to abuse and neglect, and become teen parents themselves. What happens to girls who get pregnant early? The POPCOM reports that teen moms are less likely to finish school, get higher paying jobs, and achieve their full potential. According to the National Center for Mental Health, young moms may also experience anxiety, depression, and are in danger of turning to substance abuse. Despite the passage of the Reproductive Health Law in 2012, there are still 150,000 adolescent-led families that lack support. Law-mandated comprehensive sex education has yet to be fully enforced in schools nationwide. By law, minors need to ask their parents' permission to access birth control materials in their local health centers. This is widely criticized as unrealistic. Bills on teen pregnancy reduction have been around since the 13th Congress. This early version by the late Miriam Defensor Santiago is only 5 pages long and advocates an abstinence approach in preventing teen pregnancies. Up until the 16th Congress, lawmakers attributed teen pregnancies to Filipino youths imitating the way of life of their Western counterparts. Like Angelica, girls are driven to shame and are sometimes disempowered to pursue their dreams. Teen pregnancy is also dragging the country's economic growth, causing losses of 33 billion pesos every year. That's almost 80% of the 42 billion peso national budget to implement the RH law in 2018. Last 17th Congress, the first comprehensive version of the Teen Pregnancies Prevention Bill passed the third reading at the Senate but only reached the committee level at the House. The bills languish even as the problem gets worse. In this 18th Congress, there are at least 5 versions filed. Senate Bill 161 proposes an interagency council that will be in charge of prevention and social protection efforts. Dr. Junis Melgar, a women's reproductive health advocate, believes that local and national levels play a part in not only protecting teen moms, but empowering them as well.
Number one is for parents to maybe reflect on themselves when they were adolescents and to be more forgiving, to be more understanding. She cannot afford actually judgment and further discrimination from the family that should be embracing her. I have been told that schools actually apply Magna Carta, the Magna Carta of women, so that when they have teenagers, students who get pregnant, they actually provide the girl with a choice of continuing her schooling at home, or she can stay in school. And I think it's a good environment for teaching all the other students that there should be more understanding of students like that. There should be budgets. There should be adequate budgets. So if government does that, then we will see that the predicament of teen moms would improve.
No girl should have to see her future crumble because of a pregnancy. Will the government ensure that no more children will have children?